Welcome to the meeting issue of ASJ. My selections include 4 original articles, 3 of which include a commentary. These are from the oculoplastics, rhinoplasty, body contouring, and research sections. Don't miss the 3 international translated abstracts this month in Turkish, Korean, and Chinese. Next month, look for translations in French, Portuguese, and Spanish. As always, I invite you to listen to this month's podcast series, Injection of Adipocytolysis for Body and Jawline Contouring, Real-World Experience and Treatment Considerations. And as always, I encourage you to listen to the monthly ASJ Open Forum podcast. We're always interested in the changes that lead to facial aging. In this paper from the oculoplastics section with a commentary by Dr. Joel Pessa looks at the aging of the orbit and the muscle. It's an international original article from Japan by Dr. Itsuko Okuda and co-authors, who say that to achieve effective facial rejuvenation, surgeons must understand age-related aspects of anatomic changes such as the Orbicularis OculiMuscle that not only thin with age but gradually loosen from the facial bone. Canthal dehiscence. A commentary by Dr. Joel Pessa applauds the findings that orbicularis attenuation and dehiscence from the lateral orbital rim have direct clinical significance and should help improve the aesthetic results of blepharoplasty. Contouring sutures are very popular. And from the rhinoplasty section, we have this paper from Russia by Dr. Vitaly Zholdakov, looking at the role of these sutures in rhinoplasty. So they looked at skin soft tissue envelope, critical component of rhinoplasty that can impact patient outcomes. They found that these sutures improve the predictability of rhinoplasty surgery by decreasing complications such as edema, hematoma, loss of tip definition, fibrosis, and polybeak deformity. Cellulite is almost ubiquitous. The number of patients I see that ask whether we can improve on their cellulite. I've chosen this paper from the body contouring section by Dr. Grant Stevens and co-authors. This is a follow-up of a previous preliminary report with the device that has proven to be very effective for dealing with cellulite, looking at long-term results in this current paper. There's also a commentary by Dr. Matthew Nichol. The authors have found that with the 12-month results of controlled focal fibrous band release method, CONFFIRM, they assess targeted verifiable subcision, TVS, for the treatment of cellulite. They found that it has durable efficacy and safety in reducing cellulite on the buttocks and thighs of women with moderate to severe cellulite. The commentary by Dr. Matthew Nichol indicates that in his own personal practice, this won't change anything, as he feels he can attain similar results with an 18-gauge needle, and that he feels the device does not offer any more superior results. The final selection is from the research section and it looks at virtual assistants. The topic of AI is very, very much not only in the news, but has a lot of relevance to what we do. In this paper, Drs. Francisco Avila and co-authors looked at the possibility of having a virtual assistant for a plastic surgery practice, which would be able to respond to questions that patients may have in the perioperative period or even in preparation for a procedure. The commentary by Dr. Tyler Saffron confirms the effectiveness of this AI technology, and he takes a look at what it'll bring to our practices in the future. I've always felt that the human touch is very important, and for my practice, and I hope for the physicians that I see, I'll have more interactions with human being than AI. That's it for April. I look forward to seeing many of you at the meeting in Miami. Please take the time to stop by the ASJ booth and say hello. If I don't see you in Miami, I'll see you soon with the May issue of ASJ.